there's this fantasy that it's always so romantic, it's always so heroic. Save the world, save the patient, all of that. But in actuality, we get tired. And it looks particularly hopeless for a COVID frontliner because it doesn't end.
So, hi there, everyone. Welcome back to Mindcare Club's podcast, a podcast on mental health matters.
We're capping off Stresstember with a two-part episode on the topic that is very timely, healthcare worker burnout brought about by the COVID-19 pandemic.
And since Janine is part of our healthcare workforce, she'll be leading today's interview with Mindcare Club's lead psychiatrist, Dr. Trina de Llana.
Hi, Dr. Trina. So today we'll be talking about burnout for healthcare and frontliners. Are there any early signs that you might be able to say that you may be experiencing burnout?
All right. Hi, Janine. So there are a lot of signs that we can notice about burnout. Number one, it's important that, a lot of the burnout you feel is related to your work. It's not necessarily negative feelings you might have about your personal life, your home life, your family life. It's really about work. Feeling always tired, feeling that you're emotionally exhausted, you've got nothing left to give, which leads us then to being, sadly enough, a little less sympathetic towards your patients, towards those under your care, towards even those you work with. So that's another one, having no emotional reserves, seeing people as not as people anymore, but as things to settle or as another task just to get over and done with. Then the last one is feeling a very, very low sense of personal accomplishment. So how does that work with healthcare workers? I suck. Am I turning stupid? I'm not helping. Maybe I'm making them worse. Am I effective? That kind of things. That then brings along a whole bunch of other baggage. How it kind of feeds on each other. So having negative feelings about it decreases motivation, which makes doing the next task really, really heavy.
So I was wondering, how will a healthcare worker know that this might be different from something like maybe a depressive episode?
It's actually really hard to tell on the outset. Let's go back to how you asked about early signs. A lot of the time, you don't notice the early signs. You kind of notice when you're there already. If it stretches out that you're unhappy at work, you're always tired, you don't feel like you're doing as well as you could, or you used to, that's going to tell us that, it could be burnout. Now, how to tell between that and actual mental illness? Off the top of my head, I'd really say maybe best to consult someone for it. But for yourself, as long as you're in distress, those two are definitely differentials, things to think about. Quickest way probably is to see if you're still able to function at all, even with the basic stuff, getting up every day, being able to do what you're supposed to do, your concentration, your feelings of self-worth. Are you thinking of harming yourself? It's all of a piece. It's a very good sign if you're still able to cheer yourself up or make yourself feel better. But even for those who are burned out, it's not always a guarantee. It definitely bears thinking about, but best to consult.
And that makes sense in line with looking at the person if the impairment is getting bad enough to affect their work or their family life or other aspects of their life to be able to know whether it's already a disorder. No?
Yeah, if it gets, you're right, no, if it gets debilitating.
From your personal experiences or accounts from other people in the healthcare field, would you happen to know where these sources of burnout, especially during the time of COVID, might be coming from?
Yeah, lots of places. Let's start with frontline healthcare workers. They're actually the ones who are hit by the crowds first. So physically, it's very taxing wearing the PPEs, the worry that they might be infected and that they might bring it home to their loved ones. And then a lot of tasks, a lot of smaller tasks at work because frontline work is very romanticized, isn't it? It's always the quote unquote big stuff, intubation, CPR, saving lives, making things better. All of those happen. Besides, they have to fill up patient forms, they have to do chart, they have to hand off or receive patients to and from different hospitals or even units within the hospitals. That's paperwork also. They have to keep studying because we're discovering a lot of things about COVID as we speak. So they have to keep updated all the time. So those are the less romantic but equally important things that they have to do, and want to get started on filling up PhilHealth forms so that the fees can be claimed. Those are a lot of small clerical tasks that pile up. Then besides that, we're in the middle of a surge now, or at least it looks like a surge. because, well, patient loads are increasing, more non-COVID wards are closing and being turned into COVID wards, and the COVID team does not necessarily increase in number. Okay, so we have patient volume, and then all the resources are occupied. For example, ventilators. The frontline healthcare workers have to be the ones to decide who gets the ventilator or who gets turned away. And once they decide who gets turned away, they have to do the turning away. That's what we call moral injury. So it's one of those technical terms. All it means is that the healthcare workers are being pushed to behave in ways that are not in accordance to their principles. And you don't sign up for healthcare work, medicine, nursing, respiratory therapy, everything. You don't sign up for that to tell people that you can't go elsewhere. You signed up to do things, and suddenly you can't because there are no more events. So I do take care of some healthcare workers, and they're messaging the night before their scheduled duty, and they go, I don't want to go to work tomorrow. Nobody's going to give me available vents, that kind of thing. So that's difficult. And it's difficult to watch. So this brings us to non-frontline healthcare workers. So, for example, those other members of the unit of the hospitals, of the institutions who support the frontline healthcare workers, they see it also. For those of us who work in mental health care, because we take care of the frontliners, we see it also. The technical term for what we go through is what they call secondary traumatization, because the frontline healthcare workers pretty much come to us. We listen to their stories, we process them. Then, of course, those stories hurt also. And then, personally, it hurts me a little more because you end up being a holding area for them. So they're able to express themselves, or they're able to vent, and then you process it with them, you help them feel better, because you have to send them back to exactly what hurt them. So that hurts us.
How would you be able to comment on that constant exposure to death over time and how that is affecting their sense of morality, sense of being, and stuff like that?
Starting to see your patients as tasks rather than persons. That's definitely a sign of burnout. And you said it yourself, the healthcare worker tends to notice this because that's not how they used to work. That's not how they used to see their patients, because by definition, we actually love our patients. Or at least there's this fantasy that it's always so romantic, it's always so heroic. Save the world, save the patient, all of that. But in actuality, we get tired. And it looks particularly hopeless for a COVID frontliner because it doesn't end. It doesn't end. So there's a tendency, really, because you're not expecting much better and you're tired and there's not much opportunity to rest. Your ways of thinking and feeling about your job, it it rather deteriorates. And you're seeing that deterioration, you notice it. You know it's not what you signed up for, and you know that that's not how you're supposed to. Then suddenly you start eating at yourself. You start biting at yourself, attacking yourself that, what kind of a doctor am I? Why am I thinking this way? How does this happen? This isn't me. That kind of thing, which again further feeds into the burnout. So, it's a never ending spiral that just keeps hurting and hurting. And it's not like the pandemic is going to end soon. A lot of us tend to think, this, Janine, a lot of us tend to think that, okay, I'll suffer through this now because they're going to give me a diploma later. I'm going to suffer through this now because when I take my exam, I'm going to pass. There's always a clear end. And then suddenly, we're stuck in a real world pandemic. And it's not that way. It's not, I'm just going to finish this rotation and then life is good again. That's not how our healthcare workers are living now. So it really feeds itself into burnout.
Okay, thank you for that. Okay, after we talk about where these sources of burnout might be coming from, where can the healthcare worker who is starting to experience these things or realizing that they are already experiencing these things, what can they do for themselves, muna, before going to seek a professional?
Professional care. Okay. Lots of things, actually. Although I think they already started it, or at least some have. Look at yourself. Number one, if you're wondering if you're burned out, there's a chance that you are. You probably are. So just review. Again, emotional exhaustion, depersonalization, meaning not seeing your patients as patients anymore, and then decreased satisfaction in the work you do. Number one is to identify, see where you are there, if you're burned out or not, or if you're just getting there. Second, do things you like. A lot of the people who have been burned out, I think they've already done this. Nobody gets through nursing school, medical school, etc., without knowing how to take care of yourself. Let's say that didn't work. Next, take a leave. Have you tried to take a leave? That's one thing to ask yourself. And we have to make sure it's a realistic leave. Travel is clearly not going to happen anytime soon. At the very least, travel for pleasure. Even a simple leave, such as no phone, no working for a set period of time. A really good time frame to recommend is actually 2 weeks. Take a vacation for 2 weeks. Next, it's also a very common advice to remember your why. Those of us who were training pre-COVID, it was a running joke among all of us. Bakit ka ba ako nag-doktor? Sino ba nagsabi mag-doktor ako? But, those are those are naughty jokes said in times of impatience and tiredness. But if you think about it seriously, not as a joke, what is your why? Who are you serving? So those of us who are clear about why we became doctors, why we became nurses, why we became healthcare workers, there's an answer, a serious one, a valid one, and a good one. But there are also times when you forget your why. Okay, and it's so easy to do so because suddenly your patients become tasks, right? So let's say that doesn't work. Next, what do? You be realistic. You see yourself that, this is happening to you, this is what you're feeling. You have to be able to be more clear about what you want to happen. Okay, so your everyday life has to be more sustainable. Okay, so what is our realistic amount of workload for those who are in private practice? Now, for those who are in training, who theoretically don't have much choice in what load they have, prioritize. Identify which among the things you have to do are the ones that are most meaningful to you. Okay, so suddenly it's not so much why you're doing this. It's not just the why, but the meaning of what you're doing. If you forget your why, just make it count. Wherever it is that you're assigned to, whatever it is you're expected to do, give it meaning, make it count.
Sige, thank you so much, Trina.
And that concludes part 1 on the burnout of mental health or healthcare workers. Our episode will continue next week with part 2, so stay tuned.
And just as a reminder, this podcast is not a substitute for any mental health consultation with a mental health provider. But if you feel like you want to talk to someone, you may head to mindcareclub.org to book an appointment with our first step providers.
But before we end the day, we would just like to thank all of our healthcare workers who are working day in and day out during this COVID-19 pandemic. Thank you very much from the bottom of our hearts for your dedication to serve others.
See you next week for part 2. Bye!
Bye!